As provinces across Canada start to reopen, there are concerns about the spread of new variants, and it's leading to a lot of questions about how quickly these variants spread and how effective vaccines will be at keeping Canadians safe. To answer some of those questions, I want to bring in CTV's medical specialist, Dr. Marla Shapiro. Good morning to you, Dr. Marla. Nice to see you. So there are real concerns about these variants really around the world right now, and we know that they have arrived here in Canada. So how fast could they be spreading? And how much higher could the number of variant cases actually be?
I think we're beginning to see exactly what you're talking about. For example, if we look at what's called the point prevalence in Ontario on January 20th, about 5% of the cases were related to the UK variant that we saw mostly seen in Barrie at that long-term care home. And once they're in the community with a higher infectivity rate, we know that they're likely to become the predominant strain. And one would expect by the end of March or so that we may see the UK strain as being the predominant strain that's circulating in Canada now.
And of course, this increase is raising questions about reinfection. If you've already had COVID-19, can you get reinfected with one of the new variants?
So we look to the world data to help us answer those questions. And unfortunately, what we're beginning to see is that having had COVID-19 is not a so-called free pass. We know if you've had a milder disease, you probably have immunity that does not last as long as if you had a more severe disease. But if we look in South Africa and some of their data, about 2% of the South African variant was seen in individuals who had had a previous case of COVID. So there's two issues here. If you get reinfected, typically it will be more mild, but then there's a societal risk of your ability to pass it on to somebody else who's completely susceptible. So clearly data that we're watching worldwide, learning from other nations across the country, and clearly watching what the trends are here in our own country.
Okay, now let's turn to the topic on the minds of many of Canadians, the vaccine rollout. There are dozens of countries ahead of us vaccinating their populations at a much faster rate than Canada. I'm sure your patients are asking about getting vaccinated. What are you telling them?
Well, it is disappointing at best. The news out of BC today that the fact that they're beginning to roll it out to individuals 80 and over is very promising in that particular province. But it's been excruciatingly slow for many individuals. So it really reinforces that we have to keep up our social distancing and follow the rules, particularly in Ontario, for example, as things are beginning to open up. Hopefully, the tap on vaccines coming in will accelerate and we'll be able to catch up in terms of where we are. And looking at new data that's suggesting that we might be looking at studies that may combine one vaccine with another vaccine. So the science is evolving in terms of what is the best strategy. And Canada may be one such place where we begin to look at that type of strategy, but only from a scientific point of view once data is collected.
Okay. I want to go to this next question about whether or not we're going to need to get this vaccine every year. Do you think that that is something Canadians should be prepared for? Are we going to be getting a COVID shot annually the way we do the flu shot, Dr. Marla?
If I had to predict, I'd say probably so. I think we're hearing from the World Health Organization that we're never going to stamp this out completely, but we'd like it to get to baseline levels that are no longer threats to countries. But it may be possible the same way that we see flu that is pretty much here to stay, and every year we get a new flu vaccine predicting how the strains may drift. It might be that way with COVID as well, that if it stays in the background as a low-grade infection, that as changes evolve every year, we might see the same type of strategy. We'll have to wait and see, but it is a possibility that this may become one of our annual vaccines in the future. We'll have to wait and see.
Okay, Dr. Marla, great stuff. Thanks so much. We'll see you soon.